Are you looking for professional training in forensic mental health?
So for some people who come from an empirical background, being able to speak to the literature and the research and validity of the measure works very well, especially for psychology perhaps and psychiatry, where we get the advantage of academic training and continuing education. Sometimes for administrative and decision makers, it's all about being able to demonstrate evidence-based practice that's going to be defensible. You can show how patients change as they move through your care pathway. So decision makers like that aspect of it. For some people, it's about, I want to feel safe when I go into work, right? So workplace safety, and for unions that can be very important, that we're implementing a measure that is defensible and helps to keep our nursing staff safe. And for most of us, hopefully, and most of our staff, it's also, we want to do the best work that we can with our patients. And so I think the START addresses all of these things.
And the settings that I've been working in are both community-based, so mental health diversion programs, so trying to keep people out of jails, and we're using the START in those settings as a referral tool, but also then a case planning tool for understanding what resources these individuals need when they're in these community-based settings to keep both the community and the individual safe. That it's not one or the other, that in fact you can have both strength and vulnerability in one area at the same time. And that's something, again, we'll try to give a lot more examples throughout the day and get concrete in what that means, because that is probably one of the most difficult things in completing a START assessment, is how do you wrap your head around giving a strength rating and a vulnerability rating to the exact same item.
To learn more about Concept's professional training opportunities, visit us at concept-ce.com.